For people using Adderall for recreational use, I think it's very unsafe. It raises your heart rate, and it's monitored, and your blood pressure for that matter. It's monitored closely by your doctor when they start a prescription, and so to use it without the direction of a doctor is unsafe. And we have a large number of kids that use Adderall as prescribed by the doctor here, but I have in the past years come across kids using it for recreational use. Normally they don't feel very good, their heart rate's racing and feel kind of short of breath because you're usually started out at a low dose and then increased for therapeutic level. When kids use it for recreational use, they just start at whatever they can find. So it's unsafe.
They've been using it, have they given you because they were testing or because they just wanted to try it?
I think for more like they thought they might get a high from it. And I really don't think that would give you a high.
Yeah.
It doesn't have the drug properties to give you a high, but yeah, kids take weird things to get.
Have you ever done a drug known as Adderall?
No.
Have you ever known someone who has?
Yes.
How often do you hear about it at school?
Not very often. Like once a month maybe I hear somebody about doing it.
Do you think it's a pretty big problem at Olympia High School?
No. Here, no.
So I think all medications need to be treated, with respect. If a doctor prescribes something, you should take it for that purpose. That said, a doctor might give a prescription to somebody who has ADD or has attention issues, and there are certain things in their life that, certain functions that they need to perform better at, that, perhaps they find that helps them do it. I've known people in my profession who've taken it before they grade papers.
Advise people to take Adderall for recreational uses?
I'd say absolutely not.
Absolutely. What are your thoughts on people at OHS using Adderall for recreational uses?
I'd be surprised if that many did it for recreational purposes. I know that a lot of people use it for to get their focus or to compensate for something like fatigue or something like that. That's been my experience with it, and I would advise against it and try to get some healthier habits. So I guess I don't advise it recreationally, or even if you're trying to do it to help you in some way.
Have you ever dealt with someone taking Adderall when not prescribed?
Just a couple cases that I can think of, people taking other people's medicine. I don't think a lot of times they knew what it was. I have heard of people taking it, though, before.
Tests?
Yeah, but not that many, though.
How many people do you think use Adderall at OHS, excluding people who it is not prescribed to?
Boy, that's a real mystery to me. I don't think it's a high percentage. I'm sure it's there, and I'm sure for some people it's for attention, to get their attention focused. I don't advise it or recommend it, but I imagine it's going to be a hard one to find the person because it's probably very covert, unlike a lot of the other drugs, which